Good day, fellow learners. Once again, this is your mentor, your fact check buddy, Ray Gapuz. And we're supposed to be talking about case number 47 for your next generation NCLEX RN preparations here on our YouTube channel. So, before we begin, let me just highlight something. Since we're going to talk about emphysema, remember emphysema is also known as pink puffer. And just for you to remember it in an easy way, remember emphysema, it has a P. So pink puffer. Pink with a P, puffer with a P, emphysema. To compare that to your chronic bronchitis, which is also known as blue bloater. So for chronic bronchitis, remember bronchitis with a B, blue with a B, bloater with a B. Okay, now why is emphysema also known as pink puffer? Because despite the deficiency in oxygen, they're able to maintain a pinkish color of their skin. Why is that so? Because they have learned how to expel carbon dioxide by puffing or pursed lip breathing. That's the reason why they are not cyanotic initially on their presentation. So, before anything else, before we dig any further into emphysema or your pink puffer, let me ask you to please join us in this mission. Our goal is to provide free NCLEX RN application and review to 500 nurses. And to help us achieve this, just watch and finish the ads in our videos. And if you share this video to at least 10 of your friends, we will pray for your success. Thank you in advance for doing that. So, before anything else, let me congratulate the university. It's a state university that granted me a Doctor in Science honoris causa. What does that mean? Okay. Honoris causa simply meant that I was awarded a doctorate degree for my contributions in health sciences. And the school, that's Pangasinan State University, one of the finest state universities in the Philippines. I'd like to congratulate their class 2023 and 2024 in the local licensure examination for nurses who are all now registered nurses in the US. And 10 out of the 12 passers that we have from the school, from those batches, are 85ers, which means they shut down at a minimum number of 85 and they passed the test. Okay, way to go. And let's learn from the experience of one of them. Her name, Francis Lionel Marquez Alberto, USRN, from the Pangasinan State University Bayambang campus, who passed the next generation NCLEX RN last July 31, 2025. That's just a few days back for the State Board of New Mexico. And here's what she would want to share with everyone. Tibkiram tapakinakamo, that's actually a dialect, stated in a dialect here in the Philippines, Ilocano. It says, strengthen your faith or strengthen your abilities. Okay, so that simple phrase, strengthen your faith, became my lifeline. Through doubts, fears, and moments I didn't feel enough, I held on to those words. I wasn't just fighting to pass the NCLEX, I was fighting my own insecurities. As a proud graduate of Pangasinan State University, I was blessed to become a scholar of Sir Ray Gapuz for both the Philippine Nurse Licensure exam and the NCLEX. Life didn't go as planned, but it led me somewhere better. I chose to review at home quietly and consistently. Bootcamp, comprehensive review, course shell. Well, the comprehensive review takes several months. The bootcamp is just a 10-day camp with me. The YouTube videos, QUICKFIX is just a 3-day session with me. The NCLEX 311 book, I gave my all and still I had doubts. My luggage broke, my shoes gave up, my confidence wavered. But this time, I wasn't alone. I had mentors who believed in me, friends who supported me, a family that kept praying even when I kept silent about my struggles. And that made all the difference. Ray Gapuz review system isn't just about lectures. That's who we are. We're not focused on lectures. It's about reminding you to rest, to believe, to keep going. They don't just prepare you for the test. They prepare your heart. Thank you for the kind words. To Sir Ray and all the amazing mentors, Miss Abby, Miss Nicole, Miss McLean, Miss Shans, Miss Che, Miss Missy, Miss Sol, Miss Darlene, Miss Angela, Mentor Jimmy, Mentor Josh. Thank you for believing in us. Thank you, our AGRS staff and the IT team, PSU, Institute of Nursing, faculty, and my agency for every ounce of support. To my friends and family, thank you for listening, for understanding, and for standing by me. This win is ours. Thank you, Lord. I'm proud to say I passed the NCLEX as a scholar of RAGRS. This win isn't just for me. It's for the girl who used to think she wasn't smart enough. It's for the quiet warriors fighting battles no one else can see. And it's for everyone who needs to hear this. Debkaram tapakinaka mo. Believe, keep going. So, congratulations, Miss Francis Lionel Marquez Alberto from the Pangasinan State University for passing your next generation NCLEX on your first try. And that's through our system, the Ray Gapuz system. So, this is the book that she's talking about, NCLEX 311, authored by yours truly. And what are some of the feedback that they have here? They say it in Filipino, parang reflection po talaga ng QUICKFIX. That's a 3-day program, YouTube, and 311 yung questions that I get. So happy I got through the exam successfully. Thank you, sir, ng marami. So they're saying that the questions they got in the test are a reflection of QUICKFIX, our 3-day program, YouTube channel, and 311. So please do subscribe to our YouTube channel. And then Chin says, blank came out. I was like, Sir Ray, know what topics would come out? I'm glad I'm a Gapuz baby. So they were saying it's pato. So those trending concepts are really helping a lot of people. And then, sincerely speaking, says Vic, if it weren't for 311, I would not have passed. I went through the last 4 days to the exam. That book is amazing. Keep up the good work of helping us nurses. Thank you for labeling our book amazing. And somebody says it's very legit. NCLEX 311 po, it's the best. Why? Halos same na same po siya sa pagkakakonstruct sa mga na-encounter ko pong mga standalone questions. So, the standalone questions were constructed in the very same way that the questions on NCLEX 311 are presented. So, on to our case number 47, and we're going to talk about EmPhysema or pink puffer. Remember the P in EmPhysema, it's pink puffer. It's P, not Phi. Okay? Pink puffer. So, EmPhysema is a chronic obstructive pulmonary disease. It's part of the group of disorders collectively known as chronic obstructive pulmonary disease. So, primarily, it's characterized by the destruction of alveolar walls, leading to reduced gas exchange and surface area. So, the main problem here is that the alveoli become damaged. So, how does that happen? Well, the common risk factor would be chronic exposure to irritants like smoking, environmental factors like dust, okay, occupational hazards like gas fumes. And then this could lead to persistent inflammation in the alveoli within the lungs. And then that leads to enzymatic breakdown of the alveolar walls that eventually lead to destruction of the alveoli, leading to severe hypoxia, meaning decreased oxygen, hypercapnia, retention of carbon dioxide, and this leads to respiratory acidosis, in which carbon dioxide is retained inside the lungs. Now, emphysema is most commonly caused by long-term exposure to cigarette smoke, air pollutants, or occupational irritants, and may also result from a genetic deficiency in alpha-1 antitrypsin. Alpha-1 antitrypsin has a special function of protecting the walls of the alveoli, and so therefore, it helps maintain its elasticity. So if you are deficient in alpha-1 antitrypsin, what results could be easy destruction of the alveoli and loss of lung elasticity. So emphysema causes progressive dyspnea, especially on exertion. So the main presenting symptom could be dyspnea on exertion, and there's going to be an increase in the anteroposterior diameter of the chest, that's also known as barrel-shaped chest, and then a resulting pursed lip breathing and minimal cough with scant sputum. So emphysema can potentially lead to respiratory failure, pulmonary hypertension, and right-sided heart failure, or cor pulmonale. Why is that so? Because of the increased pressure in the respiratory system, it will be harder for the right ventricle to push blood into the pulmonary arteries for oxygenation in the lungs. And just like any other muscular organ, the right ventricle, when it's pushed to the limit, it's working so hard, eventually it hypertrophies. And so, right ventricular hypertrophy can potentially lead to right-sided heart failure, and that's what is termed as cor pulmonale. So it could be associated with the increase in the pressure within the pulmonary system. So management of emphysema includes priority would be smoking cessation, and then the use of bronchodilators, corticosteroids for long-term management, pulmonary rehabilitation, and in severe cases, oxygen therapy or lung volume reduction surgery. Now, what happens in lung volume reduction surgery? They remove the most damaged part of the lungs so that the healthy parts can be maximized in terms of functioning. So the unhealthy parts, therefore, are removed such that there would no longer be retention of carbon dioxide that could potentially lead to respiratory acidosis. So when you say lung volume reduction surgery, the part of the lungs that are destroyed by the disease are removed in order to maximize the functioning of the healthy parts. So what are the signs and features of emphysema? You have here the acrostic smoking, so shortness of breath on exertion, minimal cough with little or no sputum, O, overinflated chest or barrel-shaped appearance of the chest, or increase in the anterior-posterior diameter of the chest, keeps lips pursed while breathing. That's what we call pursed lip breathing, or puffing. That's why they're called pink puffers. Increased respiratory rate or tachypnea. So it's beyond 20 respiratory rate per minute. No cyanosis initially. That's why we have the pink puffer presentation. And of course, because of their need for more energy, because of their dyspnea, they would usually exhibit gradual weight loss due to energy spent on breathing. That's the reason why when a client has emphysema or COPD for that matter, they should be given high calorie and high protein snack. Okay, like you can serve them peanuts or peanut butter sandwich, because that will enable them to source out energy from their food intake. Okay, they need additional source of energy so that they don't lose weight. Now, drugs used in emphysema or COPD management includes the following. We have the acrostic, again, lungs, long-acting bronchodilators like salmeterol or tiotropium, and then use of antibiotics like amoxicillin, clavulanate, okay, and then nebulized beta agonists like albuterol. Your albuterol has the potential to cause palpitations. Remember, PIN, palpitations, insomnia, and nausea. So it's very important for the nurse that if the patient's taking albuterol, you need to monitor the heart rate. And of course, glucocorticoids could be inhaled or systemic to reduce inflammation. And if the glucocorticoid is given as an inhaler, it's very important to assess the patient for the potential of oral candidiasis if they are using a metered dose inhaler. Okay, so the presence of whitish deposits in the mouth should be referred to the physician. So as short-acting bronchodilators like ipratropium and albuterol for quick relief. So remember, LUNGs, long-acting bronchodilators, use of antibiotics, nebulized beta agonists, glucocorticoids, and short-acting bronchodilators. So before we proceed to use what we learned in terms of the functional concepts we discussed, let me introduce you to the world's oldest passer of next generation NCLEX, proudly mentored by me. We have Miss Flor Villarreal from Bicol region in the Philippines. Okay, so thank you for the trust, Madam Flor Villarreal, US RN. Okay, so she passed the test, was December 2, 2024. Now back to our functional concept. Now, functional concepts could actually take the form of a word, a phrase, a sentence, or even an entire paragraph that gives your mind a sense of direction on how you're supposed to deconstruct questions on the next generation NCLEX. So here's a functional concept. In acute respiratory distress from emphysema, fast-acting bronchodilators like albuterol are prioritized to rapidly open the airways. So the bronchodilators should be the priority to be administered to the client. With that in mind, let's answer a case. So Mr. John Ramirez, 68-year-old chronic smoker, arrives at the emergency room with severe shortness of breath, audible wheezing that may potentially indicate narrowed airways, and use of accessory muscles during breathing. He has a history of emphysema and reports running out of his maintenance inhalers 2 days ago. His oxygen saturation is 88% on room air. We know for a fact that the normal oxygen saturation on room air should be 95 and above. So this is 88, it's below 90. So this is within the critical range of 85 to 90, okay? And he is visibly anxious. Based on the United States clinical guidelines, which medication should the nurse anticipate administering first? Now, if you are given this type of question, you would notice that all the drugs that are mentioned in the options, like 1, oral prednisone, 2, long-acting beta agonists, 3, inhaled corticosteroid, and 4, short-acting beta agonist via nebulizer, all of these are appropriate drugs for a patient with emphysema. However, the question is asking, which should the nurse anticipate to be administered first? So among this group of drugs, which one do we anticipate to be given first? What did we say a while back? Using our functional concept, in acute respiratory distress from emphysema, fast-acting bronchodilators like albuterol are prioritized to rapidly open the airways. So since the client could be having difficulty breathing, the priority therefore, the answer is number 4, short-acting beta agonist via nebulizer, like your albuterol, okay? So with that, I am inviting you to please use our simulator. We're soon going to be offering this for free. This is the first next generation NCLEX simulator designed by a Filipino, and this is the first simulation laboratory for next gen NCLEX in the Philippines. And it's not enough that you know your concepts. It's a different challenge when you're testing using technology. Next generation NCLEX is asking you to do just that. Pass a test that is technology-based. So come to the RA Gapuz Review Center building, okay, at the United Nations Avenue here in Manila, Philippines. So this is where we conduct our classes. In fact, I'm here in this room in the 4th floor of our own building here in United Nations Avenue. And this is our main hall where our classes for the Philippine Nurse Licensure exam is being conducted. And of course, we're proud to share and show to you our very clean restrooms, okay? And of course, our student lounge, okay? Please do subscribe to my YouTube channel and join more than 27,000 subscribers now who are enjoying, okay, our videos. So this is also an opportunity for you to get a free review from us if you process your NCLEX RN application with ITAPS Gapuz, our processing partner. So next generation NCLEX application processing with free review only at ITAPS. Call 0955-658-595891. So once again, this is your mentor, your fact check buddy, Ray Gapuz, at your service. Good luck to those who are taking their test and to those who are preparing for their test. See you in our next video. Subscribe to my YouTube channel and get updated with the trends. Take care and God bless you.